Hey YouTube, welcome to the first episode of The Casual Pharmacist. I'm your host Michael, and this is going to be a channel devoted to talking about drug facts, where you're going to be breaking down prescription drugs, over-the-counter drugs, vitamins, and really just talking about anything that's kind of a hot topic in today's world of pharmacy. And if you have any things you'd like to see in my future videos, just leave a comment down below and always make sure to hit that like button. Okay, so one of the first drugs I'm talking about today is going to be probably one of the most commonly prescribed drugs in America, which is Lisinopril. Lisinopril is an ACE inhibitor. It used to go by the brand names of Zestril and Prinvil, which, pro tip of the day, make sure you know both of those names because that more than likely will be a question on your NAPLEX. And now, when it comes to the mechanism of action for Lisinopril, it actually inhibits the angioconverting enzyme in the renin-angiotensin-aldosterone system. Go RAS system from now on. It's a little easier to say. And so the reason why you actually want to inhibit the conversion to angiotensin 2 is because angiotensin 2 is one of the most important peptides when it comes to regulating blood pressure throughout the body. Depending on which side it binds in the body, it actually can produce a different effect, thus increasing blood pressure. So its effect on blood vessels is that it causes a vasoconstrictor, so it causes the blood vessels to constrict and thus increasing blood pressure. When it interacts with the pituitary gland, it leads to the release of the antidiuretic hormone, which causes water retention in the body. When it affects the tubulars in the kidneys, it actually causes them to retain water and sodium, and excreting potassium, again helping to increase the blood pressure in the body. And then again, when it affects the adrenal cortex on top of the kidneys, it releases aldosterone, which again does basically the same thing, just helps the body retain water and sodium. Now, so you kind of see why it's so important to affect this. Obviously, being able to prevent the conversion to this would be just a great step in helping to control blood pressure, which is why ACE inhibitors were one of the first drugs created to help control blood pressure and are such a staple in it today. Now, some of the side effects that come along with ACE inhibitors and Lisinopril in general is that they can sometimes have a very exaggerated effect when it comes to helping control your blood pressure, causing you to actually go into hypotension and have your blood pressure being extremely low. Now, one of the reasons why this is so dangerous is that it can sometimes cause dizziness, it can cause you to pass out, and cause syncope when the feeling you get when you stand up and you almost about to black out, and then you kind of come back to, you're just fine. But syncope, you black out and you fall over. And so this can be very dangerous in patients who are a little older and whose balance is already in equilibrium, is already off. And so when they do get these drugs, they can sometimes fall and hurt themselves, bang their heads, having concussions. And so there'll be something to counsel patients on, just kind of be more cautious in the first few weeks when they have these kind of drugs, to kind of take it easy until their body gives them time to adjust. Now, some of the more severe reactions to this drug are actually angioedema, when your body has an allergic reaction to the drug, which can definitely cause a lot of fluid retention and buildup into your lower layers of your skin, which isn't super dangerous, but when it gets into your throat and your tongue and actually starts inhibiting your ability to breathe, that's something that becomes a severe medical emergency. You need to call 911 and get to the doctor immediately. Now, sometimes ACE inhibitors are actually associated with a dry cough. This is usually due to the fact that there's an increased level of bradykinin in your body. Now, bradykinin is a peptide that is normally broken down by the ACE enzyme into an inactive metabolite when it's acting normally. But when you're taking an ACE inhibitor, which obviously inhibits the conversion, or inhibits ACE, it also inhibits the conversion of bradykinin to its inactive metabolite. This actually leads to bradykinin's higher levels in the body, which can actually cause a little inflammation into the lungs and thus produce a dry cough. So usually when this happens, pharmacists will suggest to their patients, and prescribers can prescribe a different blood pressure medication for their patients. Usually the most common go-to replacement for an ACE inhibitor is the angiotensin II receptor blocker, or an ARB. This is kind of the next step in that RAS system. Well, that'll conclude today's video. Thanks for sticking with me. I know it's definitely a little rough in certain parts, kind of stiff, maybe a little scripted, but appreciate you sitting with me. And please subscribe, hit the subscribe button down below and hit the bell to make sure you are notified of all my future content. And I hope to see you in the next videos. And again, leave some comments down below and let me know what you want to see. Thanks.